Hello students, welcome to Pharma Syndrome YouTube channel. I hope you are absolutely enjoying our videos and please update to our channel and like, subscribe, comment to our channel and let's enter into today's topic, that is clinical uses, clinical applications, therapeutic uses of the antihistamines, that is regarding first generation antihistamines. In the previous video, so we already discussed the classification of antihistamines based on first generation as well as second generation, that is regarding H1 receptor blockers based on the easy mnemonics. So please go through that video. And this video is regarding antihistamines, that is first generation antihistamines classification, sorry, clinical uses. And here the classification, nothing but the clinical applications of antihistamines based on the crazy mnemonic is SMB cap, that is Superstar Mahesh Babu cap. I hope you all many know Superstar Mahesh Babu is one of the hero. So here the applications, that is clinical applications, clinical uses, first letter is yes. The first letter is yes, that is based on S, the antihistamines, first generation antihistamines used as a sedative hypnotic. So sedative hypnotics means the drugs like promethazine as well as dimenhydramine. These two are comes under the first generation H1 receptor blocker. First generation H1 receptor blocker used as a sedative as well as hypnotic. They use it to induce the sleep, the person who is unable to take sleep. Especially they induce sleep, especially in children during minor surgical procedures. During minor surgical procedures. And sedative hypnotics means generally you will study in the CNS like benzodiazepines, barbiturates, non-benzodiazepines like that. So that is regarding first letter S, sedative and hypnotic. Next letter is M. M is Meniere's disease. So this is an disease of inner ear, and especially it will cause a characteristic feature as vertigo, that is feeling of rotating of head. So to control vertigo in the Meniere's disease, one of the application, one of the clinical use of the antihistamine, that is H1 receptor blocker. And next letter B. Letter B is to control mild blood transfusions and saline infusion reactions. So for example, when blood is transfusion, means blood is transferring to one person, nothing but donation of blood person to the other person. What is happening? Okay, generally same blood group. So sometimes there is a chance of allergic reactions also. Maybe improper guidelines if we take, means any aseptic condition, non-aseptic conditions like that. So what will happen generally? There is a chance of allergic reaction. So to control that allergic reactions in blood transfusions as well as saline infusion reaction, means when giving blood to the patient from outside, definitely there is a chance of allergic reactions. So to control that allergic reactions also, these antihistamines, H1 receptor blockers are useful. And next, letter C. Regarding letter C, used in common cold, that is produces symptomatic relief by produce sedation. So common cold, sometimes this common cold may become some severe, it will irritate us. So to free from that irritation, it will give some sedation. So in the sedation we will go for some rest. So in the rest the things will come to the normal. Next, allergic disease or allergic reactions. As we know, histamine is one of the mediator involved in the allergic reaction. That's why we have to block H1 receptors in the allergic conditions by using H1 receptor blockers. That is treatment of pruritus, treatment of urticaria, as well as dermatitis, as well as rhinitis. Rhinitis means running nose. Generally, we observe in the cold. Running nose, simply rhinitis. And dermatitis means inflammation to the dermis layer of the body, skin. Urticaria, pruritus, both are comes under the allergic reactions only. So there is some little bit differences there in the terminology. And next is P, that is pre-anesthetic. So some of the H1 receptor blocker also using as a pre-anesthetic, that is promethazine. Promethazine used as a sedative as well as it is also having anticholinergic effects. It is also having anticholinergic effects. And based on the P itself, some of the antihistamines, H1 receptor blockers, also using in the Parkinsonism. The drugs like promethazine as well as diphenhydramine used for treatment of idiopathic as well as drug-induced Parkinsonism. So idiopathic means generally they occur within spontaneous time, and as well as generally idiopathic reaction means unknown reason. The Parkinsonism here, the Parkinsonism generally idiopathic Parkinsonism means that it is because of unknown reasons. It may occur spontaneously, suddenly. And a drug-induced Parkinsonism means what is Parkinsonism? In Parkinsonism, imbalance between dopamine and acetylcholine in the substantia nigra of the central nervous system. So what is happening? There is a decrease of dopamine level and increase the acetylcholine action. That is the Parkinsonism. So because of using of some drugs also, there is a Parkinsonism. That's why here it is the drug-induced Parkinsonism. Parkinsonism is due to using of some drugs like antipsychotics, some other drugs, because antipsychotics are nothing but they block the dopamine action. When dopamine actions are blocked, what will happen? There is a decreased dopamine in the CNS, and because of decreased dopamine in the CNS, there is a development of Parkinsonism. Why? Because dopamine reduction is characteristic feature in the Parkinsonism. So this is regarding the clinical applications of the antihistamines, that is regarding that is regarding H1 receptor blockers. H1 receptor blockers, that is H1 receptor antihistamines. Okay, so this is regarding our session today, that is on the antihistamines. Okay, please go through our channel for daily updates and like, subscribe, comment, share our channel. Thank you.